human and ecosystem health, especially regarding the chemical mixture toxicity pathways and their chemical fingerprint on all the living beings, considering human health, animal health, environmental health, and also ecosystem health. Because when we consider the genome, so the gene, the early step of development, embryologic development on all livings, they are all livings are done by more than 70 to 80% of water, and the early months and years of development on all beings, a tree, an animal, a human, and etc. All the biodiversity is also constitutive and constituted by water and bioaccumulating all the chemical loads that are out of all the water policy worldwide. So it's the key elements or key stakes, an opportunity also to better detect the water chemical along the water cycle and replace the water cycle as a key sentinel and a nexus on One Health with regard to the chemical mixtures. So I will be very brief. I will do my fast. So the key stakes are from water chemical mixtures and pathogen, early tracking to risk management, and place this water cycle as a key sentinel to better protect human and ecosystem health. So probably and for sure you all have heard that a lot of innovation, especially since the COVID pandemic, but also before. We speak about water cycle epidemiology or what wastewater-based epidemiology. And as Victor Hugo said more than 100 years ago, back to the 3 year, just in substance, it means that the water cycle is the intimate of all livings because so the sewer is the conscience of the city. Everything there converges and confronts everything else. In that livid spot, there are shades, but there are no longer any secret. So because all the livings are secreting some substances or pathogens that go through the wastewater, but by the way, we are all also exposed by the sinks, substances or pathogen that we are emitted. We are already the first line. So very briefly, the sanitation timeline. So you have here, and you will have also, of course, all the slides because I already have shared that with Dr. Cadell. So you can see from the, how to say, 19th on before also the different sanitary history of wastewater treatment through the ages. And as you can see, the SARS-CoV global pandemic has also provided a key and strong worldwide impulse on acceleration on how we can use the early tracking tools or biomarkers to better detect in an earlier way in wastewater bodies different chemical or pathogens in order to better protect human and ecosystem health. So the wastewater-based epidemiology has been very strongly developed during the COVID, and a lot of member states from Europe, from all the Mediterranean, and a lot of countries have worked together under scientific expertise to select the right biomarkers of interest, considering the mutation on the different variants. They also work together with wastewater treatment plant operators to improve the sampling strategies of sewers and also the relevant and appropriated analytics. They also worked a lot in terms of statistical analysis of data using bioinformatics experts and linking monitoring data with clinical data at epidemiological level studies, and also improved the different monitoring tools of the wastewater. And they work together to elaborate expert laboratories and research organization to how to say transfer knowledge to the knowledge transferred and share with different laboratories the specific biomarkers testing. So this wastewater-based epidemiology is a joint effort that should be coordinated by public health authorities. Wastewater-based epidemiology and results are complementary tools to public health metrics and not a duplicative strategy. And if well designed, WBE monitoring can save public and strongly save public expenses. Relationship building between partners and local engagement strategies are a key point to share and coordinated data, discuss public health action, and also anticipate great public health protection. So towards the next year, we are on at worldwide level, a lot of, collaboration have been deployed, and to go to the future of environmental monitoring in terms of One Health, new system thinking or new system thinking for One Health. So as you can see just before, considering the event detection, to better manage the outbreak dynamic, and also to work in a more larger scale to other pathogens and other chemical-based toxic pathways, and to enforce and deploy the non-target WBE screening. So today, the wastewater-based surveillance or the wastewater-based or the water cycle surveillance can provide key and strong indicators of public health, because through the water cycle on the different water bodies, surface water, fresh water, wastewater, reuse water, aquifer water, we can detect, track quite all this kind of exposure that can be critical for human and ecosystem health. So you can, of course, detect the different diet components like caffeine, vitamins, mycotoxin, etc., oxidative stress, for example. You can also detect in the earlier way the exposure of harmful chemicals, endocrine disruptions, the perfluorates on all pesticide and etc. You can, with biosensor, that we will go back further in details for that. Also the pathogen with the biogenomic and the different biomarkers that are able to detect in the wastewater the different first front line of pathogens between 3 to 4 weeks before the appearance of the symptoms by the citizens or animals. You can also follow, track, and reduce the antimicrobial resistance. You can also detect the drug use or drug abuse with specific biomarkers of, for example, drugs abuse, drug use, pharmaceutical, etc. You can also follow the non-communicable disease, especially induced by the low-dose chemicals that are triggering the endocrine system in an early stage of development, as considered by WHO in the 1,000 first days from fetal development for human, but also for other species or bodies. You can also detect, smoking and alcohol use, and also illicit drug and psychoactive substances. So right today, as of today, all the tools are already mature, deployed in different member states, and to replace the water cycle at the key nexus of One Health. So just to sum up what I just said, on the water cycle, we know exactly in which kind of water bodies we can find some key critical issue, especially, for example, the raw water for human health and AMR, the test-treated wastewater for environmental health and resource protection, and in surface water, you can detect all the things we just talked before for human, animal, and environmental health. Offshore, you can, of course, you can see the glass for the wash context, but worldwide, a lot of key, very important projects, collaborative projects also worked on that and deployed that at different country level or regional level. So as you can see, the different expertise are from multidisciplinary area, the sampling strategies, the laboratory or the knowledge transfer between the labs, and we can see, especially on the India and Pacific area, a lot of already One Health laboratory networks, including with the right level of safety, of course, animal health, human health, and environmental health, not only for the pathogens, but also step by step for chemical exposure. So identify also the right biomarkers for the right issue and concern regarding the different specificity of specific area. Also, we worked also to develop the trigger values. For example, we will see that just after the trigger values to better assess the toxicological adverse pathway induced by the chemical mixtures, the chemical targeted or non-targeted monitoring, different experts on different issue, the statistics and the modelization of that, some ethical guidelines, some also communication and right level communication. So just to brief that point, strong innovation, strong collaboration, and also UN organization already are implementing and considering all these advanced technologies to better protect and to be embedded in the One Health approach. So just in terms of the challenge for low-income countries with no or lower sanitation system, I just want to share this point with you. You know, ARUP is a UK institute, and they also worked in low and, you know, most in the world's most vulnerable and remote communities to use the wastewater to improve public health. So if you can just join and just visit this website, you can also have a lot of elements, and especially in this report, to discover how all these new technologies and predictive and more protecting monitoring framework are currently integrated in the WASH framework. So just now, let's consider what has been done regarding the chemical pollution, okay? So that kind of, the next slide are completely related to a big European project of 5 years, 2013 to 2018. And we work on how cities are, you know, how to say, under chemical pressure, of course, but the rains are just releasing the chemical pollution from industrial site, agricultural site, on urban site through the fresh water, surface water, but also in specific cities regarding the sanitation infrastructure level. We can also find a lot of, a strong amount of chemical pollution that are all released in the water cycle. Some have some sanitation plants, some other have less or low level sanitation. And anyway, we can just go further. And how and why is it so important to better work on reducing the chemical load of the water cycle? I would like to introduce you a big work that have been already developed by WHO, UNEP, and OECD on endocrine disrupting compounds. And I want to explain for you also, because it's quite already about more than 10 years working on that. And the aim of this work was to allow all the stakeholders to better understand that low dose chemical have also not only, but also, and maybe a more important impact on the genomes that may be higher concentration. So what you can read is that low dose matters. Every day's exposure to endocrine disruptive compounds can contribute to modern health pandemic. Why? Because, you know, in the fetal development, it's a human body, but it's exactly the same for all the trees and animals development. So the fetus during this pregnancy time is exposed to, is fed by the maternal blood, and the maternal blood is also directly exposed to air water, food, and skin contact or pollution. And the chemical compounds at very low dose level can be diffused in the fetus blood during the pregnancy. And if we already have the potency to detect the chemical load in the fetal blood of a newborn, and we can find between 600 and 1,000 chemical compounds at concentration, for example, at nanogram per liter, it's quite a salt part in an Olympic swimming pool. And all these analytics are already available in a lot of countries. And we can consider that all these chemicals now are known to be disruptive compounds that are able to trigger cellular and nuclear and DNA level in the cells of the fetus. So I will just show you further how it works. And all this kind of, chemical pressure on the genome of the fetus during this early pregnancy window. And we all think that this window is under protection, but the chemical compounds at very low dose level can reach the cells, the blood, and the genome of the fetus. And they can have some disruption of the genome expression and induce later adverse outcome pathway like breast cancer, thyroid disorder, diabetes, obesity, infertility, asthma, obesity, early puberty, lower IQ and neuro central nervous system disorder and so on, and also working on fertility or infertility, and of course for autoimmune system. So the key stakes, maybe the only things you should take away from my talk is that it's the paradigm shift. It's no longer the dose that make the poison, but the period of exposure that make the poison, the cocktail effect, and effect may be stronger at low dose than at higher dose, and it's the latency between the exposure and the effect, and they can also cross transgeneration. The chemical impact on fingerprint on the DNA, the genome of the fetus can cross 4 to 5 generations. So I can just share with you, it's quite easy to understand the key characteristic of the endocrine disrupting chemicals. Why do we call them endocrine disrupting chemicals? Because, you can see this yellow part, and this yellow part is chemicals that can flow through our blood because we breathe, we eat, we drink, or we put something on the skin. All is going through the blood and going through the different organs. And for example, on the cells, the human cells, the vegetable cells, animal cells, etc., you have some receptors of the hormonal system, or we call it endocrine system. And these chemicals came to the membrane of the cells and just are entering in competition with the endogenous natural hormones, for example. And hormones in the human body and all the living bodies are acting at very, very, very low dose level because they are like, a symphonic orchestra. Excuse me, it's my son. And in this context, so the chemicals are just entering the cells and will interact because they come together as a cocktail effect. They are like a key in a, something to open a door, a key, and with 2, 3, 4 different chemicals at low dose level, they just can have the same affinity to this receptor and go through the cells and go to the nuclear part where is the DNA, the genome, our construction plan. And they can interact with the DNA and act as, transactivation or transrepression of the DNA. So that is the DNA, the first level of our genomic information. and that is the copy of the DNA that is done whole sequence in whole cells, and they are producing the RNA. And the chemicals are coming here to transactivate or transreprimate this gene replication. And so that will then induce a strong modulation on disruption of the synthesis of, for example, insulin production, thyroid hormone production, enzyme production, or all the hormones, all the protein, all the elements that each cells needs to live and each cells need to develop and regenerate and etc. And in that context, you can see that that can induce some disruption on the hormone transport, hormone synthesis, epigenetic alteration, hormone disrupting in the circulating level, on the clearance, for example, to reduce and to increase the right level, and also to have a strong impact on the DNA proliferation that is also the basis of a cancer process. So these chemicals come at the early stage of development, deep during the pregnancy, and deep in the cells on the DNA, and have long-term impact in terms of inducing hormonal related based or hormonal based disease. And as you can just see here, yes, it's a very symphonic regulation between hypothalamus and some glands behind the brain, and also the peripheric gland. So, the thyroid that is mediating all the brain development, lymph node for the immune system, pancreas for the metabolic and the insulin production related to diabetes, reproductive glands for directly linked to fertility and natality, the adrenal gland for vascular circulation and lymphatic circulation. And so we speak about hypothalamus, H, pituitary, the two little, very small glands behind the brain, and the peripheral endocrine gland, like, thyroid, lymph nodes, thymus, adrenal gland, ovary, testiculary, and all those reproductive glands. And at this stage, it was OECD work on 2011. OECD worked with experts worldwide, already had delivered a mapping of the endocrine system signaling pathway, and the target of these chemicals and the target on the relevant hormones. So you can see that this kind of early stage process of development during the pregnancy and the fetus development are the target of the chemicals, because these hormones on these glands are the key strong laboratory or factory to produce the right level of the right hormones, protein, enzyme, and so on, that are all in charge of the body homeostasis and development. And all is under genetic information control, regulation, and so on. But when the chemical load in the blood can reach and interact directly at the level of the genome, this chemical pollution is able to disrupt all this so strong physiological regulation pathway. So, for example, mood, memory, emotion, sexuality, energy storage, immune system, timing of puberty, all that, cardiovascular function. For example, reproductive development, the regulation of male and female fertility, fetal cardiac morphogenesis, hepatic differentiation, fetal development, brain, and so on. And they can also have strong impact in terms of they are the basis of the potency to develop the different cancer on the different organs. Just to keep with that, in 2015 in Pasteur Institute in Paris, Leonardo Trasande from school medicine in New York, He is a pediatrist and also a specialist in endocrine toxicity. And he did this work to assess in terms of the cost, health effects from endocrine disrupting chemicals, cost at the European level, cost around 157 billion euro each year, considering less than 5% of these chemicals. So we just assess the cost related to the type of the iceberg. It has been done for the US and not yet for the other continent, but it should. And so the cost is here on the left, reported to the different adverse outcome pathways and disease. So you can see that most of this kind of disease related to this chemical pollution going through the brain on the body of the fetus is providing neurological impact. So autism, hyperactivity, loss of cognitive potency, and so on. Obesity and diabetes. Worldwide, we have some babies coming as newborn with already diabetes. It's worldwide. Premature death and male and also female reproductive disorder. On the other side, this cost is related to the different chemicals. So pesticide that we can find everywhere in water, in air, in soil, in vegetables, in food worldwide. The plastic release in all these components and a lot of other chemicals of flow. This cost assessment is absolutely not including the liver, breast, prostate cancer, immune and thyroid disorder, all this endometriosis that is also worldwide, or all young women, all the reproductive disorder, and all the neurodegenerative disorder or disease like Parkinson and Alzheimer and so on. So maybe this one is this French. The 1,000 first days are absolutely, critical to be protected from all the pollution that is possible to protect for. Because, as you can see, all is determined during the pregnancy. And the exposure of the father and the mother are the same before the conception, but during the conception, it's also very important to protect the mother for the chemicals she could be exposed to through air pollution, through water pollution, and through food pollution. So that is the reason why we all hear about One Health, considering first the zoonose and the zoonotic and AMR disease. But as I just explained to you, we have to integrate the chemical pressure under air, water, soil, and waste pollution, having a strong impact, silent impact on all the bodies, human, food safety, animals, vegetables, because we are all at the end of the loop. So we worked, I just share with you very briefly what we did at international level with the Global Water Research Coalition, working on how to improve the water chemical safety at international level. We worked with European Commission, WHO, and International Water Association. That is also about 8,000 members worldwide. So as you can see, to support the European strategy for a non-toxic aquatic environment, we worked to develop and to propose to EU solutions to address major gap in assessing the emerging pollutant. So detection, the low level concentration, the toxic pathways, the fate prediction, the exposure, the scenario for pollution and right abatement option on the different water treatment plants. And we provided some solution integrating innovative approach using and assessing in a better, earlier way the adverse effect, adverse early toxic mode of action, including integrating and using effect-based monitoring, ecological assessment, toxicity prediction, and for human and ecosystem health. So it is a strong paradigm shift in toxicity and safety assessment. So just briefly, I will be fast. That is one of the last big European project, 2013 to 18 in Europe, based on 3 big river basins, the Danube with about 20 countries, the Rhine with all these countries, Germany, Switzerland, and all the northern countries, and the Ibero river basin in Spain with all of that. These 3 river basins have 3 specific kind of pollution. Here in the Danube, it's more agricultural pollution. In the Rhine, it's chemical pollution from pharmaceutical and chemical and pesticides production. And here it's more linked to climate change and hydric stress, inducing eutrophisation, a low level of water, inducing higher concentration in algae or toxin, and etc. So very briefly, sorry. Here, the red point is what are covered by the European Water Framework. Can you hear me?
Yes.
I'm about 1 or 2 slides more, just ago, very briefly. So that is the regulation, the policy, the Water Framework Directive, only this little piece, 70 components. And that is all this one. There are families of chemical substances that have been found or detected in all this river basin, in all this surface water used for producing drinking water. So we are between 70 to 100,000 chemical compounds. So we work to European strategy to assess this kind of chemicals, to assess the priority mixtures, to assess the right level and the right tools to detect them, and also to combine the modelization at river basin level to the chemical compounds, substance-based and effect-based. And in order, the key outcome, expected outcome, is to provide decision makers, river basin operator and manager, tools and model and decision support system to identify the right level of abatement option or water treatment process to reduce this kind of exposure and to better protect human and ecosystem health. So just to share with you, it is cellular level based bioassays to detect the chemical pollution. Here it's adverse outcome pathway. Here it is the population level, an organism, you and me level, the organ for the liver, for example, the cellular, the cell for the liver, and here what is the molecular level occurring at the liver hepatocytes level. Before, to have a policy of one single substance, we required epidemiological studies on population level. Now with this kind of tools, we can just trigger the toxic mode of action at cellular level, and we worked on elaborating some effect-based trigger value. This kind of tools are absolutely rapid, efficient, cost-effective, more relevant for biosystem, for human and ecosystem health. They take into account a number of substances and also are using less or fewer animals. And they are also completely supported and used by US EPA, WHO, OECD, etc. So all these kind of tools have been used, deployed, and demonstrated in a large international water project, and from innovation to implementation. And we assess different endocrine pathway, estrogenic, androgen, thyroid, for example, it's hormonal disruptive compounds or pathway, but also mutagenicity, genotoxicity, oxidative stress. And we did that assessment or diagnosis on drinking water, surface water, treated wastewater, aquifer recharge, reuse, and indirect potable reuse in all these countries. So all that are currently embedded in the new Water Framework Directive. And we also worked with WHO to do, the last 4 years, effect-based monitoring, to embed effect-based monitoring in water safety planning in about 15 countries and more than 40 water treatment plants. So that is the way we work on effect-based trigger value elaboration. And for example, just to give you an idea, before when we speak about water, you have 70 compounds to be detected and measured. Now substance-based approach has been, if you can say, excuse me, but we need and we use now effect-based diagnosis that is detecting estrogenic, androgenic, glucocorticoid adverse activity. We worked on elaborating effect-based trigger values. We worked on delivering some water quality classes, not on a substance, but a toxic mode of action. And here, for example, you can have a water chemical profiling, not based on a substance, but based on a toxic mode of action. More holistic, more protective, more predictive. And you can just assess and diagnose the performance of your water treatment plants with regard to the chemical toxic pathway, and no more only a little set of chemicals. And it's a strong decision support system to help the water operator, the water treatment plant manager, to make evolve the water treatment performance efficiency to better protect human and ecosystem health. All that is already published, all this kind of, and it's also combined with Africa CDC, Pandora, and all these other stakeholders, because we are currently embedding the pathogen side, chemical side, AMR side to be all integrated in a water cycle surveillance as a key nexus of One Health and sentinel of One Health. I'm finished.